Hi, my name is Pauline and I am 72 years young. I'm going to tell you my story, which may be very familiar to many of you. A few months back, I began to experience some dizzy spells. I didn't pay much attention to them at the start, but gradually they did become more frequent, particularly when getting out of bed or pottering in the garden, or if I just stood up suddenly. I'm a very independent woman normally, and I did not want to accept that there might be anything wrong with me. Didn't even occur to me to go to the doctor and inquire or anything. Not until I had a big fall. Prior to that, I did have a few little falls, particularly when trying to get to the toilet in a hurry during the night. But that was okay. I was well able to get myself up again, and the only problem was that I found that I had wet myself. Not very nice. And of course my solution to that was drink less water in the course of the day. And that's not a good idea either. However, the big fall happened one afternoon when I was just bursting to go to the toilet. So I hopped up quickly from the couch and I felt dizzy. And before I knew it, I was flat on the floor in the middle of the sitting room. But this time I couldn't get up. Eventually I kind of managed to crawl back to the couch and get my phone and phone my son, who just lives up the road, thankfully, and he came very quickly. But embarrassingly, I had wet myself again. Not only had my son to help me get up off the floor, but he also had to help me get dried and change my clothes. Of course, he wanted me to go to the hospital, and I refused point blank. But I did agree to go to the doctor the next day. I must say my GP was more than understanding when she heard all my history. And she immediately referred me to the Falls Assessment Clinic in the hospital. Gosh, that was a surprise to me. But I agreed and I accepted my appointment in the clinic. To start with, the clinic nurse assured me that falling is not a normal part of getting older. That was nice to hear. There are many reasons why people fall, but more importantly, what she did say was that falling is preventable. So that was what the good news. So after some tests, she diagnosed that in my case I had a condition called orthostatic hypotension. Bit of a mouthful for me. But it means that if I get up from the bed or the chair quickly, or I bend up and down as if gardening, then my blood pressure would drop, just temporarily. And that's what causes the dizziness. But as she had said previously, there are things that can be done to help prevent it. So she set out a plan for me. Drink more water, especially in the morning. Don't walk if feeling dizzy. And for this she showed me some handy hints and exercises to do before going walking. The third one was take my time getting up from the lying or seated position. Now, that was a bit of a challenge for me because I still had my toilet issues. However, unfazed, and with that in mind, the falls nurse referred me to the continence nurse. Not a surprise. Mind you, I was always under the impression that wetting oneself was part of getting older. But anyway, went there, met the nurse, and she did a very thorough checkup on me, including the waterworks. Bit like an NCT. Did you know that drinking tea and coffee can actually irritate the bladder? I didn't, but I know now. And I have decided to cut down my intake of tea, I assure you. And if I choose a coffee, then it has to be decaf. We had a nice chat about bladder training, and I learned a few exercises, pelvic floor exercises, which I do regularly now. And the good thing about that is nobody knows when I'm doing them. I also know that falling or incontinence are not necessarily part of the aging process, and both conditions can be treated. As for myself, I am back to living my life, and I feel like I'm Pauline again, and I can enjoy days with my family and friends without the slightest fear of an embarrassing fall.